to crack the NEET SS in the new format, which I have Dr. Dixit Dorajia, who's cleared not only NEET SS, but he's done wonderfully well, and to be in a rank where he can choose the branch he wants and also probably the seat that he wants. His rank is 132, but remember, this was his first attempt and he's done wonderfully well to secure it. Congratulations, Dr. Dixit.
Thank you so much. Thank you.
So how many questions did you attempt? Let's go reverse. And do you think that you could have attempted more? Because I've been interviewing top 10 guys and they all are saying they attempted everything. So do you think that was the difference?
No, sir, it's same. I
Achha.
attempted 147 questions.
Okay, though that's still the nearly have full questions, right? So,
Yes, sir.
yeah. So do you think there were some questions that you could have left? And is it that you attempted 3 questions less that you got less, or maybe there were some that you attempted extra which you could have left and maybe they contributed to the negative marking?
No, sir. It's for benefit to me for attending 147 questions.
Okay. So elimination method, you could get a lot of questions right? So this is a very important message that we are getting, that everybody should attempt more number of questions.
More and more questions. Yes, sir.
Yes.
Definitely.
Right. So Dr. Dixit, tell me, where were your UG and PG from? I know where you are from. You're from but for the sake of our audience, where did you do your UG and PG from? And how did your PG help you in shaping up and preparing for NEET SS?
Okay. Sir, I have done my MBBS and MD both from BJMC Ahmedabad. I have cleared my MD in last May 2022. Sir, actually, I was started my preparation from second year MD residency program, because some hectic schedule in first year in my setups. And during MD days, I was preparing during only MD courses. It's all about it, only Harrison based, with some topic from the up to date. Sir, okay. I was not that type of student I am reading systemically, but I was reading that topic from different system according to admitted patient in my ward. So I want to application my knowledge into action, and it helps me to remember in long time.
This is very important message from Dr. Dixit, that when you see a patient in your residency, for example, you've seen a patient of multiple myeloma, that's the right time when you read multiple myeloma. If you read it, you apply it, you implement it, you know what regime you're choosing, what options you're going to give, what you ended up giving, what investigations you did you look at the kappa beta, what was the ratio, did you do a marrow, what therapy you started, did you offer melphalan, did you offer something else? When you know these strategies and apply it in that patient, then that chapter is done once and for all in your memory. So that's a very important message from Dr. Dixit. So, so you were a full question bank and the test series subscriber of DocTutorials. Tell me about how was the question bank experience and how did the question bank help you? And do you think it's sufficient enough for preparation and revision of the Harrison-based modules?
Yes, sir, is more than sufficient. In DocTutorials, there is 2 parts for question banks. One is fundamental and one is super specialty. Fundamental is only Harrison based, and the super specialty is like super specialty, Bronwald, Fieley, Bradley. And I read Harrison thoroughly in MD days. So I was going to super specialty MCQ. I have only limited period, sir, 1.5 months around to do my reading for NEET entrance exam. So I do regularly for 20 to 30 MCQ per day. And literally question bank from the DocTutorial was so much informative, so much recent updated guidelines. It's clinical question, clinical judgment. It's all except question was so impressive, and it helped me more and more practice towards me, and it helped me to get my silly mistake towards MCQ.
Right. So this all except thing is unique for DocTutorials. When I draft a question, what I do is no other platform will give you this. My point is, when I draft a question, I give you all of the following are true except, which means I'm teaching you 3 points and the 4th one is wrong. So that's not the idea, is that each question should teach you 3 things rather than tell you 1 correct answer. So all the 3 are correct, 1 is wrong, and that wrong also you remember. So you learn 4 things about that topic. So
Yes,
this
sir.
is very unique that we are
One
doing. And in
question,
DocTutorials,
four types.
they, there is a, for us faculty also, there is a rule that we cannot, we usually don't try to repeat questions, at least don't repeat the framing of the question. We try to reform the question, go through again, and it's always updated. And the question bank is prepared, like for cardiology, I will prepare. For say nephrology, Dr. Vivek will prepare, and no other platform would do that for the 2 sections that you mentioned. That's very important. So one section is the basic fundamentals, and the second is specialty. And once you have done both, it raises your confidence to the next level. That's very much right. So sir, that's Dr. Dixit.
I was reading only. Yes, sir. Initially, though I was reading only Harrison based. Then one day I give a free grant test from DocTutorials. And that day I realized that reading only textbook is not sufficient to get such a good rank. And MCQ practice is also equally important. Then only I subscribe DocTutorials question bank and test series. Then it helps me a lot to get such a good rank. I was not expecting this rank.
I don't know. Come on, you were doing good in the grand test series also. So you tell me about how were you doing in your grand test series that you were doing. He's appeared for almost all grand test series that the DocTutorials had. So how are you faring in those exams?
Sir, usually after completing my grand test, I was assessed my silly mistake and try to improve it in next test series and focus on that topic, that topic which was I had done wrong answer in the test series.
Right.
A DocTutorial test series is good as it covers all super specialty equally important, and it covers easy, moderately easy, and hard questions. And already I told that all except question, clinical questions, some fact-based questions, all are covering grand test. And after completing my grand test, I took a solution, and it converts my short-term memory into long-term memory about that topic. Yes, sir.
Right.
So very useful for me, grand test.
Right. So Dr. Dixit, I have known from his undergraduate days. I mean, he's been my student in touch with that, and for me, it's so we often talk in Gujarati. So અમે એવું વિચારતા હતા કે હું કદાચ ગુજરાતી મારા મોઢેથી નીકળશે તો દીક્ષિત બી ગુજરાતીમાં જ વાત કરતો હશે. But I think we have no problem because we have a lot of Gujarati students who are subscribing to DocTutorials as well, and so I think it's pretty okay when we talk and naturally our mother tongue comes out. So that's fine. So I think in grand test also, Dr. Dixit, you were ranking in 50s and 40s when we were doing assessing, because our grand test is done pan India.
Yes, sir. Yes, sir. Averagely 40 to 50 rank I got in grand test.
So that's pretty much, where you stand and how you're performing, how you improve. And he's given a very important point. When you realize that there's some topic in grand test you're missing on, you can go back to those videos, listen to the topic, thoroughly revise that, and then reappear for the test and then go through it. So Dr. Dixit, because he was in touch with me even before he prescribed the course, so he was part of a WhatsApp group. There's a WhatsApp group that DocTutorials, all the subscribers, they are attached to. And we post questions. Tell me about this. No platform would give you this kind of, except DocTutorials, the faculty is also on WhatsApp discussing questions. So tell me, how was your experience on WhatsApp? What was happening on that WhatsApp group?
Sir, it was amazing. I think it's the best strategy to know the topic deeply. And sir, I can talk with one of the best faculty in the every specialty within 1 to 2 hours, and I get help to solve my doubt within 1 to 2 hours. Sir, typically your cardiology group, I attended this WhatsApp group discussion. Your last drug of choice, some new drugs, some trial, some recent updated guidelines. It was sir, excellent. WhatsApp group is very useful for me, sir.
Yeah, so I remember once doing JVP, and in one JVP we discussed from A wave we ended up H-wave, as complete JVP. And I'm amazed, JVP is something that always falls so commonly in cardiology. It continues to be a high yield topic. And we still, this year also, I think there were 4 or 5
questions from JVP.
Yes, so 4 to 5 questions on JVP. So you have multiple revision. You have grant test, there are questions. Then there WhatsApp, there is a question. There's a free topic on a free lecture on JVP in the DocTutorials app. There are videos onto it.
Yes,
and then you read from the book.
I have seen only one videos from DocTutorial. It is a JVP only, sir. And it gets approximately increase by 15 marks regarding JVP. Always
so JVP,
JVP
free. So DocTutorials, I want to thank you for keeping that high yield topic free for all. So that's a compliment to DocTutorials because they kept the high yield topic of JVP free access for everybody. Right. So what are you planning to do, Dr. Dixit? There must be a celebration time at your home.
Yes, sir. I want to do my DM in cardiology. Mostly, I will get some good institute too, sir.
We have best wishes for you and welcome to being colleague from being a student. Now you soon will be a colleague cardiologist in 3 years.
Yes, sir. You are my mentor and ideal since my UG days, sir. I want to become cardiologist since my UG days.
So what, Dixit, in Gujarati, what is your message for apna Gujarati bhai bandhuo at BJMC and all across state? Apna Gujarat na chokrao je prepare karwa માંગે છે એમને ગુજરાતી સ્પષ્ટમાં શું કહેવાનું છે, કઈ રીતે યુજી, કઈ રીતે પીજી, અને જો યુજી માં ભૂલી ગયા અને પીજી માં જાગ્યા અને પીજી માં જાગ્યા તો મોડા જાગ્યા તો હવે આગળ કઈ રીતે વધવું, ડોક્ટુટોરિયલ શું મદદરૂપ થઈ શકે ગુજરાતીમાં?
હા સર, એટલે અત્યારે તો નીટ એસ્પિરન્ટ, નીટ એસએસ એસ્પિરન્ટ માટે એક જ મેસેજ છે કે હાર્ડવર્ક ની સાથે થોડું સ્માર્ટ ટેકનિક જરૂરી છે. સ્માર્ટ ટેકનિક માટે કોઈ ગાઈડ હોવા જરૂરી છે જે ડોક્ટુટોરિયલ બેસ્ટ પ્લેટફોર્મ પૂરું પાડે છે સર. And I also tell to the NEET aspirant that you should read Harrison as much as time. It is the Bible of the medicine. Everyone knows.
Correct.
Yes, sir. So I would tell to NEET aspirant that hard work is necessary.
Yes, Dixit, it was a pleasure to have you, and I believe it's a fun time and a celebration time at home. Gare છો કે આવી ગયા અમદાવાદ પાછા?
No, sir.
I mean, at the hostel or at our home?
Yeah, at hostel, sir. Currently, I am working as senior resident in BJMC.
Okay. So, do parents સાથે celebration બાકી રહ્યું છે?
બાકી છે, yes sir, બાકી છે.
So I wish you all the best and have a good fun with your family, and grand success is something that you need to celebrate with your near and dear ones. Looking forward to be associated with it, and it's always a pleasure if I can be of any help in future as well. So
okay, sure sir. Sure sir. Thank you.
Looking forward to meet you soon in person. Take care. Bye bye. Good night and all the best.